This is Debbie Allen-Denson, and I want to thank you for showing up here today with me. We're going to talk about fighting type 2 diabetes as always, but we're going to talk about the fear that comes along with it. And I don't know about you, but I know for me, I'm always thinking, is this going to increase my blood sugar or is it going to be a leveler, right? And so there's a daily struggle. That's why I call this show Fighting Type 2 Diabetes with Debbie Allen-Denson, because every day we're fighting right here. We're fighting just to be alive, right? And it may sound dramatic, but I think it's really important to see it as important. Your life and my life is important, okay? And so there are people out there that count on us, and there are people out there that we count on being there for, right? Okay. So today we're going to talk about the 4 common diabetes-related fears people have and how to overcome them, okay? All right. So let me tell you about this article. This article is from Health Library. So it says that research suggests that many diabetes patients develop phobic disorders, which is essentially being afraid of something. Managing such patients can be challenging, and it requires paying close attention to their medical and psychological needs. Listed below are a few common diabetes-related fears that people with diabetes develop and tips to overcome them. Now, I really think that, our psychological and mental health needs are not being addressed. And so you have to be responsible for that, and I have to be responsible for that. So especially a time like now that's coming up on the holidays, so many great recipes out there to help us deal with not eating the normal food that we would eat, because it's probably not good for us, right? And so we want to be a part of the meal, but we want to feel good afterward. I know I do. I want to feel good. I don't want to be laid in the bed where I can't move. And, that digestion, when it's fast moving like that, it kind of knocks you out. And so we want to always make sure that we're incorporating those slow digesting carbs. Okay? All right. I know me and my husband, we're looking into making cauliflower mashed potatoes. Oh my God. So yeah, I'm looking forward to that. Okay. Let's talk about one of the first fears. A fear of needles. I don't have to tell you. We're always somehow sticking ourselves, right? At the doctor's office or daily just checking our blood glucose, right? So many people are afraid of needles. But for some diabetic patients, the fear can be extreme, and they can not bear the thought of getting an injection. Medical experts suggest that such patients take a longer time to recover, and it requires tremendous mental training to help them take their injections. So maybe if you're on insulin or whatever, like I said, just on a daily or on a regular basis, making sure you're checking your blood glucose and making sure you're within those parameters that we need to be so that we're healthy, right? So how to overcome it? The best way to deal with the issue is to learn relaxation techniques, such as taking a few deep breaths before taking the injection. Generally, medical experts work closely with such patients to create a fear hierarchy and help them take a series of actions to gradually overcome fear. Okay, so maybe you want to talk to your doctor about helping you create a fear hierarchy if you have a fear of needles, okay? All right. Fear of developing long-term complications. I know that's me. I'm always concerned about neuropathy and, my eyesight, and just I'm concerned about those things. All right. And so, many diabetes patients face the risk of developing long-term health issues, which, in some cases, can make the patient become fearful of not being able to stop the complications. Thankfully, advanced medical treatments mean that people with diabetes are less likely to develop such complications. Additionally, you can keep your blood sugar under control by eating the right things and following a workout routine every day. I know I try to, as much as possible, to be as active as I can. Even if it's just going to my basement and straightening my basement out, even if it's just taking a walk. Something I'm trying to do to move my body, okay? How to overcome this problem. So, if you or anyone in your family has this fear, it is important to constantly remind yourself and them that taking one simple step towards healthy living can reduce the risk of long-term complications. And the one step that I know is very important and will help you with that is always just making sure you have some protein on hand. A boiled egg, a protein shake, some black bean soup. Those are some really, really effective ways to address that protein issue, okay? And keep protein first in your mind when you go to eat, okay? All right. Fear of doctors. They say fear of doctors is one of those fears, okay? And so a few people fear visiting a doctor mainly because they feel they are a bad patient when they receive a poor test result or when they feel they cannot disagree with what the doctors say about their health. Often this leads to avoiding the diabetes checkup, which in turn can aggravate the condition. I want to encourage you not to miss your appointments. Please don't miss your appointments. It's very important. I know it's hard to get negative news, but it's more hard to tell your family that I just wasn't keeping up with it. And so now I'm very, very sick and I may have to have surgery or something like that. Let's figure out how we can weigh the options, right? I would rather know because if I know, I can try to do something about it. I don't have to be perfect, but I can try to do something about it, okay? And let's talk about how to overcome this fear of doctors. If you resonate with this fear, you can deal with it in two ways. First, always visit the doctor with someone who you can trust and confide in. The other person can speak to the doctor on your behalf and let the doctor know about your opinions on health conditions in a better way. Wow, that's a good idea, right? Second, do your research well about diabetes to ask relevant questions about your condition and understand the information provided by the doctor in a better way. Being well informed will also make you feel relaxed and confident during your next meeting with the doctor. Remember, I'm always saying, write a list of questions. I always just have 4 or 5 questions for my doctor every time I see her. Every time I see her, because I want to know what this means and what are the long-term consequences, what are the short-term consequences, and how can this affect me in my journey to lose weight and to become more healthy, right? Okay, so that's how you rectify that. The next is a fear of hypoglycemia. Okay, hypoglycemia. Diabetes patients tend to get anxious about hypoglycemia, a condition in which the blood sugar level is lower than normal. The fear is more when a hypo attack occurs at night. Often people who fear hypoglycemia try to keep their blood sugar levels too high to avoid hypos or restrict certain activities that increase risk. How to overcome this? First and foremost, You must realize that you need not to be overly fearful about hypos to the point that it causes anxiety. It is advisable to speak to your doctor about how you feel when hypoglycemia occurs. They may recommend drugs to prevent such occurrences and teach you quick techniques to bring your hypoglycemia under control. In conclusion, diabetes treatment requires as much focus on the psychological aspects as you focus on the medical aspect. You can easily manage your fears by making healthy lifestyle choices such as regular exercise, diet control, and engaging in stress-relieving activities. But above all, don't hesitate to ask and seek help when needed. I want to say asking for help is a big deal. You know, sometimes as adults, we feel like, I don't need anybody. They told me what to do, blah, 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 blah. But suppose they have some new techniques. Like they mentioned in here, they have quick techniques to help you bring your hypoglycemia under control. Just suppose they can tell you something new. And if they can't, can they direct you to someone that can help you? You know, leave no stone unturned. That's what I would say. Your health is your wealth. My health is my wealth. As long as I can take care of myself, the better. But when someone else has to take care of me, that wouldn't make me happy. I don't know about you, but I want to be able to take care of myself until I close my eyes for good. And so I have to be concerned. I have to ask questions. I have to ask for help, right? It's so important to ask for help. You know, we all need help. We all need help. I need help. I need help every day. You know, it's my husband telling me no chips. Remember I told you I'm a potato chip if you cut me open. I love potato chips, but they don't love me. They don't love me. They hate me, as a matter of fact. They want to kill me inside, right? So I can't eat them. No matter how, as much as I crave them, I can't eat them, right? I've given up soda. I mean, that's something that I thought I could never do. Diet Pepsi? Honey, I used to have one under my bed. That's how addicted I was to Diet Pepsi. So we can do more than what we think we can do, okay? And I want you to remember that. And don't forget it, okay? Please don't forget. You can do more than what you think. And your health is worth every dime, every question, every request for help, everything you can give it. Your health is worth it, okay? Remember that. Remember that you are the one that's going to take the best care of this body. No one else can do it for you, right? No one else can do it for you. No one else knows you like you know you, okay? No one. So if you're afraid of needles, if you're afraid of doctors, if you're afraid of hypoglycemia, you know, these are things that you have to talk about. The long-term complications of diabetes, that's a big, big fear, right? No one wants to lose their eyesight. No one wants to lose a finger or a toe or a foot, right? No one wants that. And I don't want it for you. And if you have lost those things, hey, let's not lose anything else. Let's not make it worse, right? Let's make it better. And you have the power to do that within you. You are the driver of your body. This vehicle, you drive. You drive your vehicle. I drive this vehicle. Excuse me. My sinuses, I live in the Midwest. And so if I were to end this on any note, it would be take care of you. right? So that you can in turn eat what you want to eat. But take care of you today. And then tomorrow, take care of you. And keep taking care of you. Be consistent in this fight. Don't give up. And don't allow anyone to sway you and take you off course of your goal, which is to live a long, healthy life, right? That health is our wealth. See you next week.